Okay, welcome everybody. I'm glad to be here, and off we will go into our giggling races today. My name is Julie Schwertfeger, and I have a number of alphabet soup items after my name. But the most important thing I can tell you about myself is that I'm a healthcare provider, a physical therapist by background because of my love of movement and my belief that the body can heal when given the right physical modalities and movement capabilities structured to heal. And also that stroke and brain injury has been part of the last few decades of my life. So I've way surpassed my 10,000 mark of learning about something, and that something is helping people with stroke and the caregivers uh, deal with stroke and life after stroke, getting from rehab out into the world and beyond. So, with that, I'm delighted to be here. And what I want to do is look at what we will giggle about today. And from the last time I presented, I really hope everyone enjoyed this. I'm going to invite you, without prompting you each bullet, that as I read through these things, I want you to take a deep cleansing breath in through your nose, feel your lungs inflate. And then as I'm reading through it, blow that air out through pursed lips and try to make it take at least twice as long as it did to come in. So breathe it out slowly and completely and really feel that air going in and out. So here's what we'll giggle about today, and that's your cue to breathe. First is a review of research on laughter as a modality in medicine. So there is evidence that laughter has good effects on health. Breath two, or bullet two, is when laughter goes wrong. There are conditions and contexts where laughter can be hurtful. For example, pseudobulbar affect and social awareness impairment. Big breath three, making laughter our own healthy medicine. And this is where I will invite us all to think about and share times and places where we used laughter as a medicine. And then my favorite part is deep breath in and then breathe it out slowly. Time to share some laughter. This is where we've got a number of people. This is not just my presentation. I just get to the honor of doing some of the preliminaries. And then we're really going to have a sharing of people who are going to work to help us all laugh and feel better. So, with that, I'm going to just give a brief history. And so I always like to know, like, where did this all start? So, the first credited uh, uh, notation of laughter tied to medicine was in 1979, not on a scroll of papyrus back in the Egyptian era or anything like that. It was only 1979, and it was a contemporary book called An Anatomy of an Illness. So in this book, Cousins described laughter as creating an analgesic effect for his pain that was caused by his ankylosing spondylitis. An analgesic effect, if you guys aren't used to that big wordy term, it's just something that makes it the pain decrease, makes it feel better. And then in 2010, there was a review article that compiled all of the studies that they could find that support that there were also quantifiable or measurable positive effects in the physiology of our human persons, right? So there were changes that they could measure in body functions, which is pretty cool, just using laughter. So the other item that I double bulleted here, because I think it's some of the key points, is laughter can be locally sourced, right? We don't have to go out and buy it. There's not a big lift to go and find it or go to the right place. It can be free. We can find this or create this right in our local place where we are right now with the ingredients and the things that we have to hand. It's sustainable. We should never have to run out of it. And it has zero side effects, right? So unlike most of our medical treatments and pills and drugs and things that are so important, they all come with side effects. Laughter doesn't have to come with any of that and doesn't have any costs or of those other burdens, which is pretty cool. So that's why we felt it was an important topic for today. So the next slide talks about the health benefits of laughter. And so this goes back to some of the research I was able to pull up and thought it was a nice point, a talking point before we get into giggling and laughing with each other. One is that there's been studies that show improved mood or affect, life satisfaction, and the ability to tolerate pain and discomfort from laughter. There's also been studies that show a reduction in depression, anxiety, and stress, and also reduced agitation in one study of dementia patients. This study, I think it's nice to reemphasize again those lack of side effects. So in the agitation study, there were the same amount of benefits as there were with antipsychotic drugs, but again, the laughter did not have the side effects. Pretty cool stuff. All right, the puppy column down here is the physiological benefits, right? So this is measurable changes with things like our blood levels of things and breathing and things like that. So the physiologic benefits found in this review study of all of the laughter studies includes an increased creative thinking task of learning, increased endorphins, so that's your feel good or pain reducing hormones, and also increased immune system or natural killer cell activity. Those were measured using just laughter interventions. Additionally, so those were the increased things that they found. There also were physiologic decreases in cortisol, and that's that stress hormone, and decreases in inflammation as measured by these things called IgG, IgM, and other leukocytes. So pretty powerful stuff, right? Now, just to put it in perspective, one study can have benefits and weaknesses, including who was it that they looked at, how big was their sample size, were there biases? So none of those are absolutely ironclad of that this is a systematic review. However, there's lots and lots of research with lots of positive benefits reported. My favorite is looking at heart and brain. Right? They're like the best buds is your heart and your brain, and so laughter in your heart. Studies have shown that laughter stimulates your heart, so it makes it beat a little faster, harder, and it improves the pumping of blood through your body, including increasing that stroke volume. So when it pumps, how much is it actually effective at pushing the blood where it needs to go, while significantly decreasing oxygen consumption, arteriovenous oxygen difference, and total peripheral resistance. So it just makes your blood get where it needs to go more efficiently uh, than without laughter. It improves getting the blood to the tissues that need it. So keeping all the bits of our body healthy and thriving. And then lowering your stroke risk, very important. It reduces blood pressure. And this was a study of laughter and yoga compared to yoga alone. Adding the laughter lowered the stroke risk or the blood pressure more than the yoga alone. Pretty cool stuff. That's what I said. Right? Okay, does anyone know who this fella is on the left-hand side of the slide?
Ralph.
He does have long hair like there are pictures, Ralph, where he could be like your brother or your cousin. So this is Patch Adams. So this is that physician that Robin Williams played in that
Oh, yeah.
movie, which is pretty cool. So I just thought, who better to put on a slide and make it more fun than looking at a bunch of words. So with that, stress lowers after laughter, right? Stress is a big part of what can cause a lot of chronic health conditions and increase our risk of stroke. And so this is a systematic review. So this is one that has a lot of rigor. It looks at and compares all of the studies that are done, and it also rates them to make sure that they are a high standard of research that's considered, and it's controlling for biases and all of those things. So there's a systematic review that included 8 studies that made it into the systematic review that meet criteria. This represents 315 people being studied. And the measure used was the cortisol level. And again, that's our stress hormone. That shows that we're experiencing physiologic stress. and that does damage to our body over time if it's left unchecked, which in our modern era typically is most of the time. So, what did they do in these studies? So, they did a combination of interventions. Some of the studies, they watched humorous comedy or videos, right? So watching a funny movie, watching those YouTube things of the dogs falling over themselves and things like that. Some did laughter sessions that were administered by a trained laughter therapist. Did you know there was such a thing? And then some did self-administered laughter protocols where you make yourself laugh. However, they went about that in the individual studies. The result of all of these 8 studies was that stress was lower after laughter, and that was as a decrease in that cortisol level. So the conclusion of this systematic review, and this is just from 2023, so it's quite recent, was that using laughter as an adjunct to your medical treatments and your therapy is beneficial to improving your well-being. So the anatomy of a laugh. What is laughter, right? I mean, we do it, we've talked about it our whole lives, but have we ever thought about, like, how do you define what that is? So, laughter is a physical reaction, and it's characterized by distinct, repetitive vocal sounds, ha 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 ha, like that, certain facial expressions, and also contraction of various muscle groups. And a real laugh, like a real smile, there's actual ties to your vagus nerve and things that you can tell when someone's giving you a genuine laugh versus a pretend laugh. And it has to do with the squinching up of these different facial muscles, especially around the eyes. And then there's also 5 types. I didn't know this till I looked this up for our talk
If I
today.
could interrupt for just a minute,
Yes.
yeah, sorry to interrupt you, but I remember, from many years ago when I was teaching at Lawrence University and talked about stress and so on, that if you're getting a picture taken, if the photographer tells you to smile, the picture doesn't look very good. But if the photographer does something to make you laugh,
Ooh,
then you have a natural, symmetrical smile.
isn't that something?
And that's why if babies or children are having their picture taken, the photographer will have a squeezy doll or bounce a ball or do something to make the child laugh. Then they look natural.
Oh, I
Every
love that.
face.
And just if anyone catches this reference, I don't know if anyone is a Bob Hope fan, but there's an old Bob Hope movie. I think it's My Favorite Brunette, but it starts out where he is a child photographer, and again, and also children don't listen to you. It's the other thing, right? To have the squeezy ball. But the other thing is they found out during COVID, everyone had to be masked, and so interacting as human beings was really difficult. And there were some studies that were done that were really fascinating, and that you could tell if someone was smiling or not even with all the masking or people wearing like burqas and stuff from other cultures, because you can see it in the eyes. So I love the symmetry of the smile. And the other part is if the eyes aren't smiling, if these muscles around the eyes aren't doing that smile squint, we'll recognize that whether if we're consciously paying attention or not, our nervous system, our brain will pick up on if that's a genuine smile or if that's a smile that someone's putting on. Yeah, thank you for that. That's fascinating stuff. Okay, so that's laughter, right? Repetitive sounds, facial expressions, and contractions of different muscle groups. And we're focusing on the face, but you also kind of feel it in your belly and different areas if you have a good laugh. So there's muscles beyond just your facial ones that we can see and relate to each other. So this is the other part that's fascinating is there's 5 different types. I didn't know there were types of laughter, but it makes sense. The first is that genuine. Something just strikes your funny bone and you can't help but laugh and you notice you're laughing after it's already happening. Another is self-induced where you stimulate yourself to laugh. Another is stimulated like being tickled. Another would be induced via drugs. And then the last would be that pathological, where something is going on that you don't want to laugh, and it's not any of those first four, and it's part of that impairment. That pathologic laughter, you can see these two brains, and it shows where the wiring and things that normally can be suppressed and activated get a little bit disconnected from the way that they should be working. And that can happen after stroke. So I think that's an important thing to know about. And maybe some of us or all of us might know people who have that um, laughter or crying that they can't control, but it's incongruent with how they're actually feeling. And then that's a really important thing to support people and know how they want you to react to that and let them get through that, since it isn't just a fun, positive laughter when they're laughing necessarily. Okay, not too much more of my yapping on before we get to the fun stuff. So, just to point another picture with the laughter, when it can go wrong, that's sometimes you might call that as pseudobulbar affect or PBA. That's emotional outbursts, and that can be laughing and crying. It can be a mixture between the two, but it's out of proportion or actually can be completely disconnected from what that person's truly feeling. I did put these links in for people that want more information. The other would be sometimes there's impaired social awareness of how am I coming across? Am I reading the cues from the people in my group and reading how they're responding to mine? And sometimes that can get out of whack or impaired after stroke and other disorders. And so that would be the other thing. We're laughing if the group you're trying to laugh with in a social situation isn't there with you and not reading that's the case, then that can be a bad thing, right? It's not helping you bond with the people around you. And I thought these monkeys were nice because you see the two are relating and one is kind of left out in the cold. And when there is impaired emotional regulation or social awareness, that's the risk that happens is there can be a real feeling of isolation. And so being aware of and supportive of people that might have this going on is a really important consideration as well. Okay, now for the fun stuff. So making laughter our own healthy medicine. So I want to ask this to the group. Is there a time that you recall when you found something to laugh about to help in a difficult situation, right? To reduce the stress, tension, because you weren't feeling good and you knew you needed to do something to pull yourself out of it? I'm going to give up the microphone now and pass it around the room, the virtual room, and invite you to share if there was something you can recall and share with the group.
I can go. I'm thinking of one thing. My son was 12. I've got twin boys, and we were at this meeting after church, and the people in the congregation were in a semicircle around the pastor. And the pastor was moving far away. He's moving, and he was upset about that. It wasn't by his own choice, and everybody was quiet. They were quiet, and he was saying, "I'm so sorry to unload this all on you. I don't mean to be." And my son, who is a little unpredictable, both of them, my son goes to where he was moving was Saskatchewan, and I'm from Canada, so he's moving to Saskatchewan. And my son, it was quiet, a lot of tension in the room. And Kane says, "Did you know if you know your dog can run away for 3 days and you wouldn't see him? You would see your dog run away for 3 days?" And that relieved the tension a
Oh, that's
lot.
wonderful.
Yeah, it was cute to tell a joke that the pastor could relate to and just relieve the tension in the room.
How old was your son when that happened? Do you
Uh,
recall?
he was about 10, I think.
Oh,
Yeah.
that's brilliant. Yes. The purity of children to read and respond, and I'm sure he did it spontaneously. I love that.
Yeah, yeah,
Julie, would you unshare the screen so we can go back to seeing people bigger? Thanks.
Yes, thank you. I think that's brilliant.
No problem.
Thought I did it.
I got
Did
one. I have a couple, but I'll say one right now. I would sometimes laugh at myself when I was recovering. when I wasn't doing very well at something or couldn't do it at all to keep from getting frustrated or crying because you either laugh. Well, I mean, it's not like there's middle ground, but you can either laugh or you can cry. And in a situation like that, it's easy to get frustrated. So I would just kind of make light of it and use it as a way to move on.
Oh, I love that. Yes. Anyone else have one to share? Billy, you've got such a beautiful smile. It always looks like there's something behind you, but you're muted. You got to unmute for us. Oh, you're
I,
still
I
there.
was just, I was just thinking about when you have a loser, Ralph. You gotta laugh it off.
It's supposed to be stroke recovery, Billy.
This isn't the betting one. So how you doing, Julie?
I'm doing good. I'm also brought to mind. So this is more generalized, but during like a medical assessment or procedure, I've even seen this in some sitcom movies and shows, right, where the discomfort of the social discomfort of being in an exam room, right, where you're disrobed or you're being examined, and there's a person you're relating to, but then suddenly it's like way out of context of what you in any other situation would deal with, and so one or the other will make a joke, right, and it just kind of makes it a little bit better to take that tension and that discomfort away. Um, would be another idea. Anyone? Do you have any, Billy? Do you have some time? I have a feeling you always interject laughter.
Oh, yeah. My theory is be happy. Why be sad? Sadness doesn't get you anywhere. It only gets you deeper in a hole.
Right.
That's
I,
that's the secret. If you're happy, you will get better. When you're not happy, you're sad, forget about it.
Right. And that's not always so easy for everybody. I think
Oh,
you're wired where you make it look like it comes naturally. And
yeah.
I bet you your blood pressure and your immune system and everything is better for it, Billy. So I just love that about you.
Oh, you're a nice lady.
Oh, thank you. Everyone on this group is nice. So let's see. I see a Martha. I see Mike. I see Marilyn and Bruce. You guys, as we're talking about these examples, and Joyce, is there a time that you can think of? It can be recent. And I love that we also had one example that was somebody's son. So it doesn't have to be you personally, because we all
I can
benefit from the
remember
gift of
I can remember
laughter.
a time I mentioned earlier that after my stroke, I was sent to a nursing home for a month because I was too weak for therapy. And while I was at the nursing home, I can remember, my wife reminds me of this sometimes.
Hmm.
One morning I woke up and the nurse was there, and she had a name tag and it said RN. I looked at it and said, "Oh, RN, that must mean you're a real nurse."
That's great. Oh,
I
I
just
love
thought that
that.
was funny.
Yeah.
Um, I have another one. Is not using laughter to deal with the situation, but it's a little bit about pseudobulbar effect or PVA. They didn't. I'm sure it was around before I had my stroke 16 years ago, and I'm sure it was around before that. But they didn't tend to use that term or diagnose it as much until they came up with a pill for it. Which is usually the way it is. Um, and so I never heard about that. I know that shortly after my stroke, my emotions were like off the charts, like completely, and a little mixed up. And I found myself, I would say something that I thought was funny, and everybody'd be looking at me, staring at me, giving me, that look like, huh? And then there were other times when somebody apparently said something funny because everybody else laughed, and I went like, I don't think that's funny.
Right.
Why are they laughing? The same was true with but it extends to crying, the being over emotional. I found myself like be watching TV and I'd start crying, and I'm going, why are you crying about that? And then I think, well, there must have been something because you are, but
Yeah.
so that's a kind of a tough roller coaster ride.
Right. And I like that we use that as a counterpoint in this talk, because there's also downsides to things, right? It's not all sunshine and
Mm,
birds, unless I'm talking to Billy. That
yeah.
seems to be the exception.
Yeah.
But so I love your example, Ralph, and it's like you're in the room and you're in the group, but then suddenly you're not in the group, right? You're isolated, you're out in the cold because everyone gets it, and you're in a different place, and you're aware of that. That awareness is the part that can be so harmful. I have a beautiful counterpoint to that as well with the pseudobulbar. There was a stroke and brain injury peer group that I was leading. This was in person way before COVID, and there was a person in the group that people knew that this person had pseudobulbar, and occasionally would just get overcome by emotions. It wouldn't even have to be a conversation. Might have been saying hello, might have been in the middle of conversation, might have been just in the middle of someone else talking. And this person just started to cry, like sob, right? With the vocalizations and the tears and the facial gestures that makes everyone go like, oh, what's wrong? But everyone knew nothing was wrong. This is the pseudobulbar. And there was a gentleman in the group that I just thought was such a hero in that moment. And he said, and said the person's name, we'll call her Julie because it's my name and that's easy for me to pull
Mhm.
up. Said, Julie, we know that this is your pseudobulbar. You take the time you need. Here's some tissues, and we'll wait for you. You jump back in when you're ready. So just said it out loud, said it for the whole room, matter of fact, normalize that this is just part of what we know to expect, because this is what this person has going on, and this is our friend, and this is how we support them. And we just go forward and know that they need that time to let those emotions come out and do what they're going to do. And we know that they're going to recover, or they'll cue us if they need something else, right? Which was lovely. So, okay, anyone have another pseudobulbar or emotion regulation story? Those are important too.
Add one thing, is that it- what's interesting to me is that the laughter itself, not everyone finds certain things funny. Like I'll see something on Facebook and is the caption and other things are saying, oh, this is hilarious. This is so funny. And I don't think it's funny. It's a guy riding a bicycle on a bar and he falls off and he hits himself and hurts, or a woman wiping out. Those kind of things I don't think are funny. So I think laughter or humor is relative, I guess, in the way we see it.
That's a
For
really good point. Yeah, my sense of humor and your sense of humor might differ, right? So there might be things different people find funny. And so I have one I want to share. So, some of you may own some of these shirts, but I like when it's group humor, right? So, do any of you own, or have you seen someone walking across a parking lot that has on the back of their shirt, "I had a stroke, what's your excuse?" Have
Yeah.
you seen those?
Yeah,
Or
what's your
right? So
superpower?
and yeah, exactly. And so it's teasing, it's funny, but it's also empowering, because it's saying, look, when you see me walking, if I take a little extra time, my shirt just told you I had a stroke. And I also kind of ribbed you, right? And so there's something wonderful and powerful about that, and can be very healing in a social situation as well, which I just love. The other thing I love that's I've seen out there, and maybe some of you have too, where someone needs a cane or an AFO, and they'll decorate it. They will decorate it where it is a party, right? And that's not so much a joke, but it's something that brings lightness and joy to something that otherwise might feel like a burden, right? So it's taking it and saying, let's celebrate this. Look, if I have to wear it, it's going to look cute because I'm cute, you know? How wonderful is that? And then let's see, Marilyn and Martha, did one of you, or Joyce? I saw you pop up for a second. Sometimes if you have noise in the background, the speaker picks up and puts your picture more prominent. Or Debbie, do you guys have anything that comes to mind as we're chatting through this?
I got one.
Hey,
So,
Mike. Yeah.
Hi. So, I bruise easily because of blood thinners. I mean, I'm sure, there's a lot of people that do. And, every time I'd go into the ER, I mean, I know it's not funny to my wife, but it's funny to me. And they, because they're rather large bruises. And they'd ask, "Oh, how'd you get that bruise?" And of course, I'd always say, "Oh, it's just my wife."
Yeah. My wife beats me.
How
So-
come all the guys on this call started laughing before the punchline? Look, you guys all saw it coming.
We knew where it was going.
And
Oh no.
and then I get the look from the nurse,
Oh
and
no.
and then I get, from the wife, "Oh, will you stop that? Will you shut up?" while she's laughing at me, and she's like, "One of these days they're just gonna come and they're gonna take me away." And
Figure out cups. Oh.
That'll fix
Well,
you.
see, I love that. But I love that Ralph from is almost after your first sentence, Ralph was also already giggling. So I'm gonna guess you boys, you have really the first gigglers have done this to the gals in your life, put them in that position. So you're in the ER, you have a big bruise. It has to have medical attention. That's serious stuff, right? And so you're
Well,
lightening the mood for everybody.
yeah, well, I mean,
anything
it's not
throwing you-
not the bruise that I'm in there for. So,
Oh,
I'm in there for, stroke related symptoms, and they just happen to see it on my leg or my arm. So, I just break out and say, well, it's, the one right next to me. And
He beats me.
so, but then, I mean, because half the
James.
time you don't know where you get the bruises,
right.
and they just show up, and they can be rather big, and to me that was funny, but
Oh,
to,
yeah.
to her not so funny.
Oh my gosh, I love it.
Mike, especially if they say, "Could you step in the other room, sir?"
Yeah. We need a minute alone.
They go back to your intake form and look and see if you check the box whether or not you feel safe at home or not.
Am I safe at home?
Yeah, I don't know why that. I don't know. I guess that's important to some people. Well, I guess I kind of think it's funny. I guess because I've always felt safe at home.
Yeah.
Well, yes, right. And so here we are in this public group, we should say when somebody is being abused, and that does happen, that wouldn't be funny anymore. But clearly this is not that case, which is that incongruence is that juxtaposition makes it funny, and because you are safe, and it's just throwing your
What
wife.
Mike's doing is a variation of laughing at yourself or the whole situation, just to make light of it.
No, it's called throwing his wife under the bus.
So,
You
if
said
you're
it.
back to wearing that T-shirt, if you wear the T-shirt yourself or you make fun of yourself, I mean, it's okay. But nobody really wants to hear. Nobody wants to have somebody else make fun of them. Having a stroke gives you a license to engage in that kind of humor, and really wouldn't be funny if somebody who hadn't had a stroke did that. In fact, one of the things I did for this meeting, I don't think they're here. Well, I didn't hear back from one of them. I found two comedians that had strokes, and one of them said he would be here. The other one was, well, his whole page was like about booking him and everything. He was like on tour. So I wasn't expecting necessarily to hear back from him. But, it wouldn't be funny if a regular comedian did. It would be not only not funny, it would be insulting if somebody who hadn't had a stroke started launching into a routine about how funny stroke is.
Right. Yes. And so the context is so important. And that's where we talked about that awareness. Somebody could not read a situation and cross the line, right? Or in their group, in whatever context. So that's a great example of saying, like, there's things that are okay for a group of people to do because they live with something, and then everyone else can be invited in by that person to have some laughter, but it would be crossing the line for them to tell those same jokes, right? Absolutely. Does anyone else want to share? I know we had some people, Ralph, I didn't get to check in with you of our queue, but I know there were a group of folks that said that they would be interested and happy to share some humor to help us all laugh as well. In addition, so where are we at with that? This is a good check-in point.
I don't know. I invited 6 people. The 2 comedians, I heard back from one and not from the other. My friend Marcus was going to come, but then he realized he had a long-standing doctor's appointment and couldn't make it.
Okay.
He's going to send me something. I thought he was going to send me some of his jokes, but he sent me some thoughts on it, which were pretty similar, and I didn't print them out. I can't read them right now. Like I
That's
could
okay.
get them. They were pretty similar to some of the things that we've already talked about, like in terms of it being good medicine. I didn't know to ask him, if he was here, I'd put him on the spot and ask him to give an example. I do know that he used to do a joke a day thing. The reason I invited him was that, and the fact that he felt, that laughter was an important medicine in his recovery, and therefore he, proposed other people embrace it.
Okay.
But
Well,
we got Dr. Hetzler and Mindy and Martha. I don't know where they're at in terms of whether or not they want to do anything or, but those.
Well, I'd be happy to, if you want to hear, I've got some jokes I could tell you.
Oh, no.
All right.
Hey.
Billy.
Okay, well, I'll tell you some, like, sometimes I wake up grumpy, other times I just let her sleep.
Your wife must be out shopping.
No, she's actually behind me in the kitchen. She heard this before I told her to church the other night. But speaking of my wife, Ralph, you might recall I gave a talk on consciousness and the brain. Before the talk, I asked my wife if she knew what consciousness was. She said, "Oh, yes, that's the annoying time between naps."
She's probably getting out the frying pan right now. Better watch your back.
Dr. Esther, you better check your medicine tonight when you go. Make sure it doesn't give you an extra dose.
Good point. Good point. Here's another joke that has nothing to do with my wife. A duck walks into a bar and asks the bartender, "Do you have any grapes?" Bartender says no, so the duck leaves. The next day, the duck walks into the same bar, asks the bartender, "Do you have any grapes?" Bartender says no, so the duck leaves. The third day, duck walks into the bar, asks the bartender, "Do you have any grapes?" The bartender says, "You came in here yesterday. I didn't have any grapes. You came in here the day before. I didn't have any grapes. I don't have any grapes today. If you ever come in here again and ask for grapes, I'm going to nail your feet to the bar." The duck leaves. The next day, the duck walks into the bar, asks the bartender, "Do you have any nails?" No. Then do you have any grapes?
That's a good one.
I didn't see that one coming.
I didn't either.
Good.
Does anyone else
Thanks,
have
Bruce.
a joke? Joyce, were you going to chime in?
Nope.
I do have if somebody doesn't have a joke queued up, but you all can be thinking of one. I have the YouTube of the belly laugh day. So this is making yourself laugh. And I want to again ask everyone to reflect. If there's some point in the day, maybe it's a medication you take that doesn't taste good, maybe it's a shot you have to have, or a pain that you get when you're doing something that you really is a burden on you. If you can find a way to introduce a joyous thought or a laugh at that moment and see if it helps you, like it helped Norman Cousins, right? To say, does it reduce that pain? Does it make it a little easier to bear? And while I do that, I'd like to share my screen again and share the actual video. It's only 2 minutes and 15 seconds. It's for World Belly Laugh Day, and this is Laughter for Well-Being. I just sourced this looking and putting together the talk today. But I would invite us to all try to kind of go along. Although she lays on the floor on her back, I don't expect all of us will feel comfortable doing that. If you do, go for it, but you don't have to. All right, let me see if I can't share this.
They may not be able to get back up.
That's
I'm with
right.
you.
But you have friends online. We can help, right?
Yeah.
Okay, so I want to. Do you see it yet? Wait a minute. Do you see my screen?
It's not
Yeah,
full.
but it's not full screen.
Ah,
I guess that'll work.
is that better? Wait a minute.
Still not full screen. Got
I
to
don't know what I
play
did.
slideshow from the beginning or something. I don't know what happened.
Well, you can hit that. You can hit the icon on the far right. There you go.
Is that better?
Yep.
All right, here goes. And hopefully you hear it. If not, I'll have to fix this.
Lynn, at the far right of the bottom of the video is another toolbar to make it full screen. Far right.
The far right. What do I need to do? This.
No, you're good.
There we go.
There
Is
you
that
go.
better? Okay.
Yep.
Yes, there we go. Thank you.
I don't think it's playing anymore.
Did I lose it?
It seems frozen or something.
Oh, so wait, I think I have to stop and restart. Whatever I did, it got it angry.
And just check your sound. You might not be playing it through the PC.
The danger of playing things live off the internet.
See, Ralph has warned me of this.
Yeah.
All
It's good you
let's see
have
if
it.
In there, Ralph?
One thing you might do is not play it full screen. That may take too much
Oh.
bandwidth for.
Okay. All right. If you guys can indulge my, where did it go?
Just take your time, but hurry up.
Right? No pressure. Oh, Julie. But so you've already gotten the gist, hopefully, that she's walking us through how to self-induce some laughter.
Well, just from what you said, I didn't really hear anything that she said.
Oh, really? Oh,
No, we heard
Not
nothing.
much.
Julie,
It may
also
not be
please
making it
post the
through
link.
Zoom.
So I have to do something where my share audio. Okay.
Sorry, Julie,
Yes.
if you can just post a link to it as well in the chat, that would be
Oh,
great.
that is brilliant. I'm going to do
Yeah,
that.
I usually put the link. Also, Debbie, I put the links in the. I already made a note to put Julie's PBA links, and I've got a couple too in the
Awesome.
underneath the video, so anybody out there watching can also
Thank you.
have access to them. So I'll make sure to get we did that with the other video she shared or didn't share last time.
So eventually
Thanks,
got
Ralph.
shared.
Look who's come to say hi. You got any jokes for us?
Yay.
Huh? All right, time to move on. The Zoom meeting isn't complete without Mercer coming to say hi. Dr. Hetzel,
Okay.
you got any other jokes in your back pocket for you could
Try one more time.
Well, you brought a cat in. It's a little long. I could tell you one about a veterinarian.
Okay, I think I know that one, but go
Oh,
ahead.
I told you that, but the others probably haven't heard. Okay, a woman walks into a veterinarian and brings her pet parakeet in, and excuse me, her pet canary, and tells the veterinarian, "I think there's something wrong with my canary." And the vet says, "Well, put it on the table over there." He goes over and looks at it, says, "Well, I'm sorry, but your canary is dead." And she says, "Well, how do you know? You haven't done any tests or anything." So the veterinarian leaves the office, comes back in with a cat on a leash, takes the leash off the cat, puts the cat up on the table. The cat sits on its hind legs, looks at the canary, reaches a paw forward, touches it, leans forward and sniffs it, then walks around the table, sits back and looks at the canary, sniffs it, touches it, goes all the way around the table, then looks back at the vet, shakes his head no. And the vet puts the leash back on the cat and takes it off the table, leaves the room, comes back in, a Labrador retriever, a dog, a Labrador retriever on a leash. Uh, Unhooks the leash. The dog goes over to the table, gets on his hind legs, puts his forepaws up on the table, looks forward at the canary, sniffs it, reaches a forepaw over, touches it, goes all the way around the table doing that, then looks at the vet, shakes its head no. The vet goes over to his computer, types a little, gives the woman a bill. She reads it, says $300, but you didn't do anything. Veterinarian says, if you'd just taken my word for it when you came in, the bill would have been $10. But now with the CAT scan and the lab report, it's $300.
That was worth it. All right, I'm going to try one more time, but I worry about, you said the sound didn't sound right.
Didn't hear anything.
Well,
It
was frozen. It was frozen mostly.
Yeah, the video was playing, but the sound didn't transfer, I presume.
Well, it may have been muted. I didn't get a chance to look at that. I can tell her there's a little thing next to the play button, and if it's not up, you won't hear the sound.
Okay, I'm going to share my screen again. I'll try one more time and then I'll not try anymore. Oh, wait, no. I think I see what you were saying, Ralph. So when I hit share screen, it's got share system audio. Haha. I think I got it.
Also, there's a YouTube setting.
No, she
It's
was
on.
fine on YouTube.
It's on. It would have an
Belly laugh.
Here we go.
Yay! So if you are ready to try a good belly laugh, here's a few tips. It is harder to laugh heartily if you're slouching or standing with rounded shoulders. It is easier if your back is straight and your chest open, with your gaze straight ahead or slightly upwards. It is even easier to be seated, but best of all, to be lying down. This is because your muscles only fully relax when your body knows it can't fall over. Less tension equals more laughter. Therefore, lying down on your back with your knees bent is the easiest. Opening your mouth a bit wider allows laughter to come from deeper down the abdomen. And wear loose clothing. Have a go. You will have noticed in the video that I was able to start laughing at will, without needing humour to start me off. But don't worry if this doesn't come easily for you for a while. I've been practicing after all. Smiling, chuckling, giggling, singing, dancing, making any joyful noise or movement will help those feel-good chemicals in your body to activate and lighten your spirit, mood, demeanour and attitude. So when someone says lighten up, just start with any of the above. You can't lose. Give it a try. For weekly laughter tips, come and join our Facebook group, Laughing for Wellbeing, and check our community Facebook page, Laughter for Wellbeing.
Okay, how'd I do? Did that
Good.
work?
Great.
Yeah, that worked.
Okay, so who else, when she's laughing, could not help but laugh?
What came to my mind is that I said, "You want what?"
Oh, now, and Bruce might have some great thoughts on this too. And we were talking about laughter earlier and about the facial muscles and around the
Yes.
eyes. Did you notice how she said to laugh, one to release the tension in your body, which is where getting a position where you're not afraid of falling over. But the other was that looking slightly upward, so that the eyes are a big piece of this. And I know there's a tie to the vagus nerve, which is kind of fascinating, and in human communication interaction. So that looking upward, if you're in pain, if you're having sad thoughts and you're trying to have something in your hip pocket, in your toolkit to feel better or to feel less sad if you're down, looking up, sitting, and that was the other thing. She said, expand your chest, don't be slumped. So sit up tall, look up, and if you can try to even make a joyful noise, whatever that might be, it might be a mantra that you say or something. It can help. And there's actually some very interesting research behind this that talks about our physiology and our emotions. And so I feel this way because something happened to me, but then there's also this happened to me and I feel this way. So it's in two directions. Like you can change your physiology by looking upwards, by making those laughter noises, that repetitive sound, and it can actually change your physiology as well as vice versa. So there can be that way of empowering yourself to say, "Oh, this always makes me really sad. I don't want to be sad. I'm going to try doing those noises and getting in this posture that is tied to humor and laughter and feeling good." And that actually can help drive you to feel better, which is, I think, a really nice medicine to have in your hip pocket. Um,
But
that was
I don't see how that involves the vagus nerve because eye movements are controlled by the adducens, trochlear, and oculomotor nerves. And vagus just goes to your internal viscera throughout the body. So I don't see how those are connected.
right. It doesn't cause the facial muscle changes, right? That's facial nerve,
Right.
and
But
and
the eye
but
movements, that's the adducens, trochlear, and oculomotor nerve.
yes, and I think it's about the overlap of their nearness to it and perhaps some crosstalk that happens where the vagal that vagal break in communication is the research that I'm looking at, like the polyvagal. Um, so it's not that they control the eye movements, but that they influence and are tied to that. There's some crosstalk there. And specifically with smiling, with what happens in the ear bone, in the middle ear, with smiling, and the changes in the position of the anatomy, and how that then influences the vagal nerve. So it's not direct; it's an indirect route. But that's getting off the topic. I could have left that off. The point that I was really trying to make strongly is by inducing yourself to laugh, even if it doesn't feel genuine at first, it can actually drive you to feel better, um, which is hard to wrap your head around if you really think it through, but can be a very powerful and simple thing to do. If you have that in your hip pocket, have it at the ready. Do you have any thoughts on that, Bruce? Oh, yes, Ralph.
I'm terrible at telling jokes, but I thought of a really bad one while when you were talking right after the video, and that would be that she doesn't obviously know about stroke survivors and looking up. Anybody else have, other than me, have? I had a lot of trouble after my stroke. I still do somewhat, not near as bad. Looking up is not the simplest thing in the world to get over, or it wasn't for me. Anybody else have issues with looking up?
Initially, yeah.
Initially,
Of course, it
So how
depends.
did you overcome that, Ralph?
by looking up.
Looking down.
But I mean,
Right, Ralph,
that
because
would be my stock. I'll let you talk in just a sec, Bruce. That would be my stock answer to anything. It's kind of like I used to say to the people I worked with in person locally, I'd get them to do something. I'd go, "You're not very good at that," and they go, "No," and I'd go, "You know what that means?" And they get this real worried look on their face, and I would say, "It means you got a lot of them in your future." The things that you can't get, that you aren't good at or can't do. I've always just kind of taken the head-on approach, and I looked up. I first noticed it in like the big box stores. I was shopping for light or ceiling fans or something, and they're all up there. So what I do, I just I touch something, and that made it better.
Oh, I love that.
Made the fear go away. It didn't make the slight disorientation go away. But if you keep doing something, your brain gets used to it, I guess.
Yeah.
Well, the eye muscles, those exterior eye muscles are like any other muscles, and you can strengthen them by using them. So if you have trouble looking up with one eye, you just keep trying over and over and over again. It'll get stronger and you'll get better at it.
Yeah.
At times
And
in yoga and breath class, we have our hands over our eyes and have you look left, look right, look up, look down.
the other thing I always like to say is there's no cheating and feeling good and moving, right? So incorporating your shoulders, that tipping your shoulders so that they're up, tipping your chin so it's up, laying back over something that's a little curved to help tip to go up. Even if your eyelids and the eyes positioning themselves up is giving you trouble, you can enhance it. So even while you continue to try and you continue to work on it, it's not cheating to tip your head, to tip your shoulders up, to recline backwards so that you're looking more upward. I also like to incorporate the arms, right? If you can get your hands up, one or both of them, it starts to pull everything else up this way, right? And so you kind of do that arc and breathe in while you do it. You can really play around with that and feel good. And anytime you incorporate breathing, I think is always better. So, but that's my bias.
I just looked up all over the place and held my head up for a while. I don't seem to have any trouble with it. The one time I notice is if I'm looking at the full moon, standing out in the backyard with nothing around me, nothing to touch, all black sky. Yeah, and I think it's more of a fear thing because of we after our strokes for balance, we're a lot more dependent on horizontals and verticals. And I find it more difficult to, well, I don't fall, but I find that fear creeps in when I don't have visuals. I'm kind of a visual person. Actually, we had a neuro Pilates guy on here, and he said that you have balance if you have any two of the three: proprioception, visual cues, or your vestibular system. If you have any two out of the three, your balance will be okay. If you're missing two of them, you better work on getting one or more back. So I think it's that the fact that I don't have any visual reference.
Yes.
Well, I fix it by if I'm with somebody, I just say, "Can I put my finger on your shoulder?"
Brilliant.
Finger on the shoulder deal works a lot. It works for walking. I've had people who were real uncomfortable walking without their cane put their finger on my shoulder, and they seem to be fine. It's not like there's a handle there or anything. It defies logic, because it's not like they've got something really to hold on to, but it does quiet the brain for some reason.
It's that little bit of more signal to noise of where the body is in space, and it's just so powerful, right? But we are very visual animals, right? So vision, even if you didn't have a stroke, as we age, we get more and more reliant on vision, which is hard because sometimes people's vision is not doing so well as they age either, right? The eyes get less flexible and can have more issues. But we can become very overdependent on vision. And looking up in the night sky with nothing around is very disorienting, right? For I think for most people, they'll feel unsteady. So okay, it is 11:03. I wanted to invite and see. We've had lots of giggles. We've talked about serious stuff and when things go wrong with laughter. We've talked about and even watched a video of somebody making themselves belly laugh. That, of course, induced laughter in me. So that alone could be a video that would make me laugh and make me feel better. Does anyone have any new insights or any other jokes that they want to share as we wrap up? Yeah.
Well, I didn't want to put either Martha or Mindy on the spot, but if they wanted to do something, I also wanted to do tell a joke or do a little routine or whatever. I didn't want to shut them out either. So I don't want to put them on the spot, and I don't want to shut them out. So it's up to you. It's up to the two of you, Martha and Mindy.
Go ahead, Martha.
I did my whole routine a couple weeks ago in MI OK Zoom class. So I don't know if I need to go through the whole thing again, but
no, I recorded it. I could actually stick it on the end of this.
Yeah. But what I found out is I've been married for 38 years. And in 38 years, my husband has done some really funny stuff. So it just cracks me up every time I think about the silly things that he's done. And one of them was that meal, if you guys remember, he made a crock-pot dinner that was delicious. And I asked him what meat was in it, and he said it was steak Bennels. And it was so good. I said, well, I'm gonna have to look that up. I'm gonna have to find that package in the trash can to make sure I get the right meat when I go back to the grocery store. And it was steak, all right. It was steak BLNS. And I didn't want to break his heart, but BLNS was not Bennels. So I had to call him. I said, oh dear, BLNS was not Bennels. It stands for boneless. So from that day forward, everything that we cook in the crock pot is called Bennels. So no matter what we put in that crock pot, it's Bennels. It can be chicken Bennels or whatever. As long as it's in the crock pot with rice and a can of cream of mushroom soup, it's Bennels.
It's boneless.
Yeah.
Thanks.
I love that. I love the picture on Facebook where you're getting out of that big truck.
Yeah. Yeah, we had
I'm sorry.
Go ahead, Mindy. Oh, I'm sorry. That was me still. It's hard to shut me up sometimes.
Oh, no, I thought Mindy was trying to say something.
If only if Martha is done. I think that's hilarious, Martha. Your husband is he's very talented. It's good to do that, to have that kind of flexibility. For me, my talent is laughing at myself. I do that a lot, and what I wanted to share, I have many stories, but I'll only share one. I had 41 years of being a motorcycle badass. I was a motorcycle mama for 41 years and until the stroke. Anyways, this one time I was on my bike and I needed some gas. So I stopped at the gas tanks in town, and I couldn't help but notice there was a a guy on the other side pulling up in a Jeep on the other side of the gas tank. Didn't pay too much attention other than that. But as he got out of his vehicle, I'll never forget it. He had a white t-shirt on, young man, about 20 or so, same age as my boys at the time. So I'm about 50, right? And so I took my helmet off, and he comes out of his Jeep, and he has got a black leather vest. And he says to me, "Oh, my vest would look really nice on that bike." And Mindy, of course, without thinking, she said, "Hop on, you could be my bitch. Hop on, you could be my bitch."
That's
And I
good.
go, "Oh my goodness, did I just say that to this young man?
Well done, Minnie.
Oh, you
That's
could be
good.
my bitch." And I walk really fast to the gas station. I gotta get out of here. I gotta get out of here. And I thought that was done. It's the things that I say. Well,
Well
3
done,
weeks
Minnie.
later, 2 or 3 weeks later, we're having a family barbecue. I'm in the kitchen, apron on, and I'm working on potato salad. And one of the twins comes in and says, "Mom, I brought my friend Kevin.
Oh,
He came in. He's coming for barbecue." I turned around. There was my bitch.
Oh,
There are many stories, so that is just one I will admit to.
oh, Mindy, you're quite the lady.
Just one though to share. Okay.
We may have to
Okay,
export it.
I'll tell you one more.
The show.
I'll tell you one more. I'm on my bike. These were bike stories. I'm on my bike with the whole family. We were all bikers.
Yeah.
So what we did is that we always kept my husband in the front, our little chicks in the middle, and me at the back. So we're going down the highway, stop, wait for a break, and okay, time to go. No problem, time to go. So off we are down the highway, and then all of a sudden I noticed this car coming towards us. Hey, hey, hi. Mindy's thinking, "Hey, badass. I'm such a badass." And then another car goes by. "Hello. Hey." So I'm going, "Hey, that's me, badass." My husband turns around. I could see him in the front going, "Hey, hey." So he pulls over, and I turned around to look what's going on. The toilet paper in my saddlebag, I forgot to close the saddlebag.
Oh, God.
So my toilet paper about a quarter of a mile blowing behind me. Yeah, there's Mindy the badass.
great.
Toilet paper blowing. Just crazy.
Yeah.
So thank you for letting me share those two
Thanks for
stories.
sharing. Anybody else? Martha, did we cut you off in all that?
Well, that's all right. I just jabber on. So
Okay.
But I have a little journal that I keep for stories, because sometimes the funniest things happen around you. You're part of them, but you just don't pay any attention. But if you sit down at the end of the day and think about the things that made you laugh or made you smile, and you just jot them down in a little notebook, you can come back. You can come back and look at them another day and make you smile all over again.
That's a good idea for somebody, going through the ups and downs like we all do sometimes, and like you particularly do right after a stroke, or the first however long after a stroke. All right, anybody else, or should we let Julie go?
One last thought I have as people are thinking about if they have funny jokes or stories to share. is, as we learned, a lot of times the fellas like to use their wives to rib in their humor, which is funny. I love Mindy's examples of things that she's done that are funny and shared those stories. The other thing that I don't think anyone has shared is, and sometimes at our own expense, right? The other thing is our pets. Sometimes pets do the darndest thing, or their reactions to us. Does anyone have a funny pet story, or something that they might do all the time and it makes you smile every time they do it? That's another magical little place to get humor and to lower our cortisol and have health benefits.
Mine needed to come out and see what the laughter was with that video. He
Wants to
wasn't
be
too,
part of the joke.
he wasn't too sure about it.
Oh, I love that.
One of my cats came through and said what he thought. He always, I mean, it's like you can't have a Zoom meeting without me. When I get on the phone, sometimes, not always, but generally, if I'm talking on the phone to somebody, he will do anything to get my attention. One time I was in the kitchen and I was talking on the phone, and it's not a galley kitchen, but there are counters on 3 sides and a big space in the middle. And I was talking on the phone. I was like cooking or doing something, and he kept like annoying me and pushing me and everything. So I stopped doing that, and I backed up and went over to another. He came over there and he pushed me. I finally was standing in the middle of the room where he couldn't get to me to talk on the phone. It's like they know. It's like, I haven't wanted your attention all day, but now that you're giving it to somebody else, I want it.
Yep. Now this is years ago, I had a ferret. Do you guys know what that is? They're funny. They're funny just to look at them. They're funny little animals. But I used to take her everywhere. This is when I was in college. I used to stick her in my jacket even and just take her with me. And she'd sit with me on my lap in the car and everything like that. So we were very close. But I was at home and I was trying to do my workout, right? So I had my little yoga pad and I was doing some push-ups. And she crawls out because they tend to sleep during the day like a lot of pets. So she crawled out and she's like, "What are you doing?" Right? And so every time I do a push-up where you go up, she positioned herself right here in my line of vision. And I'd go up and she'd go like this. Talk about looking up. And then I'd go down and she'd go like this. And to where I just was bawling over with laughter. I couldn't do my workout because like we just learned, you have to have no tension in your muscles to laugh. And if you're laughing, you lose all the tension in your muscles. And then I was like, okay, took a break, went back and did it again. She positioned herself in the exact same spot and she did it again. I go up, she looks up. I go down, she goes down. And just looking at me like I'm the oddest little thing in the universe until I'm cracking up and I can't do my push-ups again. Oh, it was the darndest thing.
That's good.
Well, the good thing about that is I was reading an article yesterday that says that laughter can give you the same cardiovascular benefits as a light workout.
Ooh.
So
and it's more fun.
Yeah. So that's what my new message to my husband is when he's telling me that I'm not exercising. I said, well, you know what? Let's start, and I'm just going to put on a funny movie. Say, here's my workout for the day.
Oh, I love it. I love it.
And I know there's some laughter yoga available too, but I couldn't find any free laughter yoga to look at it. So, but there are some available.
And that's that study we mentioned, right? Is yoga with the laughter had more benefits than the yoga alone and reducing cortisol. Yeah.
Well, Julie mentioned your name was Julie, right?
Yes.
Julie mentioned at the outset that laughter will release endorphins, and endorphins will block pain.
Yeah.
So if you have pain from your stroke, which is common, I know whenever I would go in for physical or occupational therapy, the therapist always say, "Now, do you have any pain?" I'd always say, "Not yet." But anyway, if you laugh, that will relieve the pain. And I can tolerate pain until it hurts.
Oh God.
Didn't see that one coming.
Oh.
All right. Well, I guess we ought to wrap this up. And thank you, Julie, for presenting and leading the discussion.
Thanks everyone for sharing. It's been lovely laughing with all of you.
Yeah.
So why is the mushroom always invited to the party?
Why?
Because he's a fun guy.
Oh,
Oh no.
And how do you tell the difference between a male chromosome and a female chromosome?
Oh.
You
I
pull
don't
down
know why.
you pull down their genes.
Oh. Oh God.
that's a good one. Oh,
Dr. Hessel, you may be in trouble.
Yeah, I was just gonna say, I think he might have just memorized those two.
Oh, yeah. Well, what is the difference between in-laws and outlaws?
Oh,
Outlaws are wanted.
oh God. Oh.
I like its laughter and groans at the same time.
Right.
So what do you call a row of bunny rabbits hopping away?
A receding hairline.
Exactly.
Oh
Good job.
Wow, he got one. I guess it takes one to know one.
Right. If two wrongs don't make a right, what do two rights make? An airplane.
Oh,
right.
Right, brothers.
Oh,
Oh man.
Historical joke.
Oh.
Look at all this. Try and not that I'm in a hurry to sign off, but try and sign off, and the jokes are coming out of the woodwork.
They needed that pressure of having only a second left. They work under pressure.
Yeah.
So Winnie often asks a question at the very end of the meeting when we're closing out. Winnie, you got a joke?
Nope, I don't have anything today.
No jokes today. Okay.
You are enough just being here, Winnie. It's great to see you.
Oh, thank you.
And we always get to see Marilyn smile. Gotta love that smile.
What a beautiful smile. Yes. Thank you for that.
You have to come more often. It's a lot of fun.
Well, it helps when the topic is laughter.
Yeah.
It better be fun.
But we can figure that out, Billy. There's a endless amount of things to talk about in terms of stroke. I mean, it's not like you're going to run out of material.
No.
So as we get ready to go, or let Martha and Bruce recharge with some more jokes that they have in their hip pocket, I want to assign everyone the homework of identifying a time when you have pain or tension or something that makes you feel burdened or sad, and think about everything we talked about. And it could even just be one of these jokes. But the body position, right? The sitting, uncrumpling, sitting up tall, relaxing your muscles, tipping your head back, looking up if you can, and thinking about how you can bring a funny thought, a laugh, even laughing out loud. Remember, it's that repetitive ha 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 ha. So you want to make that noise, and it can be an internal, but see, I think even more powerful if you make that noise. But think about how you might use that the next time you're in that situation, right? Because if we rehearse, if we think about this stuff ahead of time, we're more likely to remember it when we need it, right? And that's that powerful tool in our tool bag to have a better life, right? And that's what I know all the work, Ralph, and so many of you that come regularly, that's what we all want, right? We want to have our best lives, live better, be healthier, and enjoy. So I'm hoping that there's something you take away from today, even if it's just one of these silly jokes, that you use. Make your world and your life just a little better. And then this is a powerful meeting, and that's what we want.
Well, that's a good homework assignment.
Myself included. I'm going to do that as well.
We're gonna start analyzing you soon.
I think I might be being studied already. Yeah.
All right. Well, thanks again for taking the time and come share your thoughts and knowledge and thoughts with us.
It's been an honor and a pleasure. It's lovely to talk with you all.
Bye.
All right.
Bye.
Bye-bye.
Yeah. Bye-bye. Thank you.
Bye. Thank
Bye-bye.
you.
Thank you.
Do all you can with what you have, in the time you have, in the place you are. Do all you can. Do all you can.